Dr. Daniewkor, Khongwir, Assistant Professor of Institute of Pharmacy at Daniewkor University. Welcome to today's practical session about blood grouping. The aim of the experiment is to determine the blood group of an individual. So the principle of blood grouping is based on the reaction between an antigen that is present on the red blood cells and an antibody that is present on the antisera. So when blood is mixed with the antisera, for example anti-A, anti-B or anti-D, agglutination or clumping will occur if the corresponding antigen is present on the blood cells. So why is it important for us to determine the blood grouping? It is important because it identifies a person's blood type or blood group, for example A, B, AB or O, and an Rh factor which is positive or negative. So why is it important to have this blood grouping or to determine a blood grouping? It is because for blood transfusion, so that when a blood is being transferred to another person, there will be a compatible blood grouping and then there will be no serious reaction occurs in a person's body. So this blood grouping is not only important in blood transfusion but also important in pregnancy care, organ transplantation or maybe emergency treatment, and especially in forensic investigations. So in this experiment, students will learn how antigen and antibodies react in order to determine the blood group of a person. Thank you.
Here are the requirements needed for determination of blood grouping. Now you take 2 clean glass slides, a sterile needle, antisera, cotton and ethanol, and also take a clean paper and mark the paper as A, B and D. Now here is anti-A, anti-B and anti-D. Before pricking the finger, sterilize it with ethanol using cotton, and then you take the needle and prick the finger gently. Squeeze a little amount of blood and place 3 separate drops of blood on a clean glass slide. Then after adding the blood, add each drop of the anti-A serum to the first blood drop. Then you take another one, anti-B, and put it in the mark B. And then lastly, you take anti-D serum and add it to the third blood drop. Then mix each drop separately using a different applicator, or here in this case take a clean glass slide and use different corners of the glass slide to mix the blood and the antisera. You can leave it for some time to observe the agglutination. Then here in this result we can see that there is agglutination in A and D. So here the result is A positive. Thank you.